we were talking about medical terminology and how you get two parts to a word, which will give you a term that they use commonly in hospitals or in healthcare settings. What we will be talking about this afternoon are abbreviations, which are also a big thing. So if you want to get your little notepads, and as I mention things or you hear things that might interest you or you don't know about, please take note, and then you can always look back on it afterwards. Right, so what is an abbreviation? It's a shortening. Oh, slideshow. Yes.
Enable content. There you go.
Oh, thank you.
And slideshow from beginning.
Oh.
No.
Slideshow. Oh,
No,
I see
no.
what you mean.
Yeah.
From beginning.
There you go.
Ah, welcome back. Session 2, medical terminology. So what's an abbreviation? So we've got a definition. It's a shortening of a word or a phrase. I've got a bit of a film here for you to see, a very short one, which hopefully will work. Have you got volume as well?
Should have.
Close the door, keep it open.
Do you want the door closed?
Yeah. I'll grab that.
Yeah, I know that guy.
Yeah.
He's an avatar.
Just have to see why the volume is not working.
You better go back to the video, and there's a little icon, and it's on 0, so you have to turn it up on the little icon.
Okay, little icon.
So click on your video, see down the bottom next to the pause button?
Yep.
Yeah, click on that.
Okay.
It doesn't support it. Why does it change in the volume? I don't know about that one. Sorry.
Okay, so let it start to play and see if it actually does anything.
Okay.
No, it's not. Okay.
Right. Okay. Well, it's a shame, but we'll talk about abbreviations.
Do you want me to get it up so that you can play it?
Yes.
Yep, so it'll be in there.
Thank you.
Just while you go continue on, or?
Okay, well, we use abbreviations for everything in life, as you know. And again, in a healthcare setting, abbreviations are a huge thing. And awkwardly, and as much as irritating as medical terminology is, abbreviations will mean different things to different people. So I'll get you to write down some examples of abbreviations that you're aware of in just a moment.
This looks very interesting.
It's not that one.
That's the ad, sorry
Yeah.
guys.
That's it, skip ad.
Alright. Alright, you ready to watch that?
The volume's cut off again.
Moving on to the other reason for the meeting, cool, so then is how phatic is spelled. Alright, moving on to the other reason for the meeting, we really need to go over our KPIs for the month and make sure we've got all of our CTAs by EOD.
Actually, Ron, I haven't got the triple O for my PTO yet.
I didn't approve your PTO, in fact that's going to be UPL with a PC. So let's get BOT and finish this REM, okay? We're going to get QA on this OS because the ISP said this UX isn't up to scratch. We won't be able to perform B2B OPS if the CMS isn't ready.
I'll get on top of that CMS and check the CPC as well.
What about PPC?
Yeah, I'll check that as well as the ROS and the SEO as well.
Ali, have you got the UV stats for the SWAS? We need that ASAP by EOP.
Yeah, all good, Ron. I've got the OTC, MOM, TBA. Then the CFO has asked me to get on the EDS and EST ASAP.
Thanks, Elliot. No, Adam, you've actually got an easy afternoon. I've just got one simple little task for you to get on with.
Oh, good.
So we've got the NSOR coming down the PQ to this ARPO. I need you to be on the FTG ASAP until this TTG comes through with the ROG. Get the DDA done by EOP, then you can LWR and take SBO. Shouldn't be much about the PQY because most of the people have a QW anyway. All good? Yeah. So, let's go back to work. WTF? TY for watching. No.
So that was an example of how, oh, I just have to shut this down now. Do you want to get it off the screen?
Yeah, just go to your next thing. It's your slide, it's your PowerPoint.
Oh,
So just go to your,
oh, it's not doing anything.
yep,
Yeah,
so
there.
just your next one, down the bottom.
Oh,
Not that one.
this one.
Yeah.
Okay, so that's abbreviations badly. And that's how much they affect us in our life, and they're used everywhere, but especially in healthcare. Go back one. So when is it not appropriate to use abbreviations? Well, very much like medical terminology. Don't use them to patients because they'll always mean something else to them and not what they necessarily need to. In a healthcare setting, pharmacy, hospital, outside care home, anything at all to do with healthcare, never, never, never use it in reports or anything that you write, because if that document, they're all legal documents, and at the end of the day, if it has to go to court, they're not allowed to have abbreviations. Plus, you'll have a multitude of staff, and they'll look at the documentation and see abbreviations, and they'll mean something completely different to that person than they did to you. So never use it in documentation, but obviously use it in notes and use it in speech to the right people. Other departments, they use different terms. In mental health, we use a lot of terms which are not used elsewhere. Abbreviations are not all used internationally, as I just said, and they change from hospital to hospital. A common one is OD, once daily. That's very common. You say that on our ward and it's an overdose because it's mental health. So you have to be very mindful of what you're using and where you're using it. Another very quick little thing, I'm hoping it will play this one. Do we just do the normal play?
Okay. So just go share at the top of your little video, yep. And click on that.
This one?
Yep.
Look, I'll take 10, you take 10. Get in, get out. No smiling, no hugging, no letting no cry. Just be quick about it.
You're the one slow.
But I am not slow, you are
You
slow.
want to bet?
Yeah, you are.
A comprehensive work
Did not reveal any
has
matter.
to have mild
Your
issue.
doctor was negative,
Deep venous thrombosis, so there's no need for chronic
coagulation of the oral IVC
The
node.
biopsy was positive.
Broad-based anaerobic.
Not based on the cognitive infection.
Your BUN and creatinine elevations had us worried
Probably progressive glomerulonephritis.
which could have signaled an autoimmune disease.
What does that mean?
We're not going to amputate your leg.
Huh? You get to keep your kidneys.
Congratulations. You can go home today.
Yeah, congratulations, whatever.
Congratulations. There's nothing wrong with you. You're gonna be fine. Congratulations.
Doctors can be your friends, and it's great when it's a good outcome, but you do have to be mindful about what you say to your patients because, excuse me, and they will stare and wonder what's happening. Excuse me. Okay. That's it. Common abbreviations used in hospitals. So we'll do a group activity. Now what I'd like you to do, and we'll have 10 minutes to do this if that's okay with you. To write your answers down. in different pairs, I'd like you to write 5 examples of abbreviations and give their meanings. You may not know hospital abbreviations, so we put abbreviations do not necessarily have to be medical, but have to be common abbreviations used in life. We want to see if everyone understands what they are, because I know that if you're kind of this high and under 15, every sentence is an abbreviation and parents are just left not knowing what they're talking about. I also need you in groups to read the following paragraphs, interpret what they mean, and then we'll talk about that afterwards. So 10 minutes, is that okay?
So do you want that split up? Or do you want the activities split up, or do you want?
Yes, if I can put you into groups of 2. Okay, so just 2, 2, 2, 2. Great, thank you.
There you go, Deb.
Let's go. Is that all right?
Nah.
Thank you. Just see how you get on with that.
I've heard of it before. Mass index.
So are they writing?
Yeah. You can just write it down on the bit of paper, it's fine. You can just put squiggle over it. As long as afterwards we'll talk about it, see what you've got, see what you think of.
It has some Jew bandies. I don't know what that sounds like.
Blood sugar.
That's it, yeah.
Yeah.
Hand over?
Yes.
Yeah.
And or there's blood sugar level.
If anyone really comes unstuck, please let me know.
We're stuck already. That was COPD.
Who's working in a group, or do you want me to give you your own, or if doesn't pen?
He's in contact, so can't be contact.
Oh, is it Black Jackie?
Yeah.
That's fine.
He has PU
No,
10 times
I
the
think
two
this was on the floor downstairs. Is that yours?
Thanks.
Has,
Second time today.
will it be, you reckon, something neuron? PU. Oh, you know, I can shake my brain. Can we shake
No
it?
using your phones.
I know, I've got a sheet in my, I've got a sheet in my work.
Oh, have you?
Yeah. PU. He's got a UTI, which is urinary tract. Yeah.
If anything, it will expose it.
He can't get it.
Oh no, that says catheter.
Yeah.
SPC. No, that says catheter.
Urinary tract infection. What is this one? Yes. F. Or on the eye. This is ES. So what's this one? TS, that's
Something sufficient.
Hyperactive disorder. Basically, they can't stop. They're gonna keep moving.
That's right.
Oh, we also have FBC.
Full blood count? No, that one.
And then TFT.
Hyperactive disorder. Am I saying that right?
Yeah,
Yeah.
hyperactivity disorder.
Yeah, that's it.
So people that find in a classroom setting, for instance, that lack concentration with fidget, can't keep on task, don't complete tasks.
What does AD stand
TFT.
What is that?
Attention deficit. Yeah, sorry. If you don't know some of them, don't be afraid to guess.
You reckon? ADX antibodies? What does X mean? You would call it
SH.
antibodies has to be.
SH. Wait, what was the SH?
HIPH.
And SH. And one of them.
History,
YO stands for.
I know referred to.
No, history's HX.
Yeah, no, which is referred to, you referred to someone. Referred to what department?
If there was something you don't know, write them at the top of the sheet of paper and I'll explain them afterwards, and then you can put them in your book unless you write them to start with, and I'll just tell you what the answers are afterwards.
So we don't know COPD, we don't know PU. I reckon it's up to
UFM.
I reckon.
Down there.
What else we don't know?
Unidentified flying.
AXR. You got AXR.
They're the four of them got stuff on, aren't we?
Yeah.
National Basketball Memorial.
Yeah. TFT is not on me. TFT.
Taking his full blood count and.
You're doing well. No, it's good though. You're making a good attempt.
Oh, what's his one?
Rate.
I think she said it in here.
It isn't, no. These are all the terms which you will hear time and time again.
It said no Google, but I've got the medical terminology in there.
Oh, yeah, but
And the brief, I printed it off, yeah, you printed it off this not that one.
All right, 2 minutes, people.
Right at.
There you go. C was it chronic obstructive pulmonary disease.
Oh, that's HMI. Ah, so you put the EMI. Bowel movement infection.
pulmonary disease.
Try to do a hand over that.
Just go. Just go ON, because then I'll know what it is.
I think it's hydration.
Yeah. All right, 1 minute. Practically done.
Sort of.
Okay.
Like, no, I don't want to say it, so.
PU is past you, right?
You had you on your
Okay, everyone, if you can put your pens down, and we'll go through. Now, I've divided everyone's, there's one group over there that have paragraph 1 and another group over here who have paragraph 2. So, groups with paragraph 1. Who wants to represent your group? We'll do that table first.
We got paragraph 2.
Oh, you've got paragraph 2. Okay, well, we'll start with that one then. Okay, does someone want to stand up and tell, and just read up into his urine? Just go to that sentence, if you read up to there, and tell me what you've got for the different words, please.
So Dylan was elderly
Yeah.
gentleman, yeah.
With COPD, which is chronic obstructive pulmonary disease.
Well done.
And a history of smoking. His BMI, which is body mass index, is 38, and he uses a walking frame.
Yeah.
His breast.
You did do that one.
No, we missed that one.
Yeah, we need that.
A 13, but he has edema
Edema. Yeah, I think that's got it wrong.
in his leg.
Mhm.
He has diabetes and his BLG blood glucose level.
That's right. Some people call it BSL, some people BGL, so it's blood sugar level or blood glucose level.
Yeah, is high. He is incontinent on urine, and has passed urine 10 times in 2 hours.
Well done, good job. Who else has got paragraph 2? Group at the back? Do you want to read that out loud for me and tell me what you've got?
Who rise in malodorous and on taking in FTC, his FTC from blood count.
Yep.
And TFT, that is thyroid function test.
Well done.
And he was found to have UTI, that is the urinary tract infection. Brought on by EF or ES or F, that is end stage renal failure.
Yes.
He will make comfortable and has SPC, that is the suprapubic catheter test.
Yeah, suprapubic catheter, that's the catheter that doesn't go directly into your bladder from between your legs. It actually goes here, okay, just above your pubic bone. And that's for people who have a long-term catheter when they can't pee. Carry on.
Inserted to assist with the bladder, he was given a course of ADF, that is antibiotics.
Well done.
And referred to HITH, that is the hospital in the town.
Brilliant, that's great, thank you so much. Okay, paragraph 1 people. Who wants to go first out of you two?
Well, I don't know about reading anything, but I can give you what I've got.
Okay.
YO stands for years old, HR, heart rate, HRS, hours, just learned now, ADHD, attention deficit, hyperactivity disorder. I just realised this now, BP stands for blood pressure.
That's correct.
I thought it was bipolar, but it's blood pressure.
Yeah.
PM, I think it's past warning. PMH, I think PMH stands for pulmonary heart, but I can't say for sure.
Okay.
DC, discharge. COPD, chronic obstructive pulmonary disease.
Correct.
Which I just heard.
And both of you, so.
Sorry, what's the hour or?
Right, what it is Jenny was BIBA, which was brought in by ambulance, following an OD, which is overdose.
Yeah.
Jenny is a 25-year-old lady with a HX, which is history. When you get SX, it's symptoms, and HX is history. In medical terminology and abbreviations, when they have 2 letters and it ends in an X, it's normally symptoms or history. DX, often doctors will use that as diagnosis of ETOH and SH. So that's alcoholism, and SH is self-harm. Her PMH is past medical history, is ADHD, which we know ADHD is an illness with depression. She was seen by the RMO, that's the regional medical officer, who requested she be NBN for 24 hours. That's nil by mouth. That is one of the most common abbreviations you will see in and around hospital. So they should always be marked up on a patient's bed behind their head. If you ever feed someone and they've got that on there, don't. That's basically it. Always check to make sure they haven't got NBN above their head or in their nose. She was to be given 2 litres of normal saline NS and have her BP, you're quite right, blood pressure, and HR, heart rate, monitored every 5 minutes. She was tachy, and that means tachycardia is when you have a very fast heart rate, and her resps, or respirations, how fast she breathes, were 8 PM. A respiration, for anyone that's interested, when you're doing someone's resps, in and out is classed as 1, not 2. So in, out is 1 resp, okay? She had a flat affect. Now again, a affect is a word that we use every day. A flat affect in mental health terms means that they've got no expression. They're pretty flat. And was unresponsive to physical stimuli. Her BMI, that's body mass index, was low, and her BSL, which is blood sugar, was 3. So glucose was given stat. That means immediately, right away, now. She was taken for an ECG, which is an echocardiogram, where you put all the little probes all around and it looks for your heart, it monitors your heart from the front, the side and the back. And FBC, as we know, for blood count. And she was shown to have AF, that's atrial fibrillation. Atrial fibrillation, if you look at a heart and it goes up, down, up, down, up, down, AF is where it flutters like that. So it's not actually pumping anything, it's just kind of in a bit of a moment, and it's very, very fast. And it's not pumping any oxygen around the body. All meds were withheld, and she was put on VOUFN. Now here's one, visual observation until further notice. So until further notice, UFN is a very, very common day-to-day term that we use in a hospital or in a healthcare setting. Her AXR is, her AXR is assessment, hang on a minute, I have to actually look that myself, I do apologise.
Did anyone have that, the AXR?
Yeah.
What have you got?
X-ray.
X-ray?
Yeah, abdominal X-ray.
Abdominal,
Came back fine. And on further AX, so that's assessment, she was woken and was responsive, so she's now getting better. She was moved to MAU, which if you work in a hospital, that's a very busy unit, the medical assessment unit. As soon as someone comes into a hospital, if it's not obvious that they haven't broken their leg or they need surgery, everyone at some point will go to MAU. That's the fastest, most time-consuming, busiest unit you'll get on a hospital. So if you do want to ever work in a hospital, any of you, and do casual work or permanent, I would suggest that you go on to MAU because you will learn a lot of information there in a short space of time. So she was moved to medical assessment unit where she recuperated and was DC, that's discharged, that's right, at one week later. So when we say 1 week later in a healthcare environment, we do 1/52. We count how many weeks there are in a year. So it's 1/52. So if someone was going in 1 month, can anyone guess what that would read as?
1 semester.
Perfect. All right, that was great, thank you. So here we have some common abbreviations used in hospitals. Blood pressure, UTI, which is,
Urinary tract infection,
well done. Anyone remember HR?
heart rate.
Well done. BO. Now you'll be asking patients this all the time. It's like, that's it, yeah. Have you PU'd and are your
Bowels open.
bowels open? That's it, yeah. And here we have it, NBN, nil by mouth. So no food, especially in a surgical environment. Now here's a new one, IDDM. Anyone got an idea?
What by mouth?
IDDM is insulin
Nil.
dependent.
Nil
Oh, yes,
by
so nil
mouth.
by mouth, yes.
Nil.
NIL, yeah. IDDM, that's insulin dependent diabetic mellitus. Diabetes mellitus?
Yeah.
Is it like that?
Diabetes,
Yeah. PU. Do you remember what PU is?
What was that one? Pass urine.
Well done.
What?
Past urine.
PV. I put that one in. I won't put it in, but I put it in. The P is, you get, in our hospital setting, you get lots of P's, okay, at the beginning of things. You get PV and you can get PR. It'd be interesting, write this down.
Yep.
It comes from a Latin word, but it's per vaginal, and PR is per rectal. So if you have to examine anyone or give anyone medication, and that's the area that you go into, that they will say PV or PR. So it's per rectal, per vaginal, PER, and then the word afterwards. And here we've got the others that we spoke about, FBC, full blood count, or fluid balance chart. These are how easy errors can happen just by two letters meaning something totally different depending on where you are. PO, per oral or post-op. OD, overdose or once daily. Ectopic pregnancy, growing within fallopian tube, is also, if you say to someone, I have ectopics, I used to get people look at me and say, oh, you poor thing, that must have been really sad. And I couldn't understand why they were so sad for me, because all it was that I had an abnormal heart rhythm. For anyone that may ever get stress, an ectopic feels like you've got two hearts beating in your body at the same time. On an ECG, what it will show is just an upside down, well, just a U, an upside down dip. It's a sudden moment of your heart stops beating and there's a gap between one beat and another, and then they'll suddenly beat together at the same time. And what you can do to combat that sometimes is I cough, I might go, and it kind of sets everything back again. But when people say to you, oh, I suffer from ectopics, don't just automatically think, and if it's a man, and that's fine, you know that it won't be that, but don't automatically think that, oh, you know, that they've got issues with pregnancy, because the likelihood is that they've actually got a heart condition or something that involves the heart.
What is the palpitation?
It's a kind of a palpitation. What it is just literally, instead of your heart going, have any of you seen an ECG report?
Yeah.
Goes up, goes down, goes up, goes down, with an ectopic, it will go up and it'll go down, then it won't do anything, it'll go like a half moon, and then it'll go back to normal again. But it does feel like you've got two hearts in your chest all of a sudden. It'll feel a bit uncomfortable, not painful, just odd, and then you'll notice that you can feel, if you put your hand here, you can often feel, or if you feel your pulse, if any of you know where that is, below your thumb, you feel your pulse, you can actually monitor it there, and you can feel that sometimes your heart might go da 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 da.